So now I'm pleased to welcome Diane Archer of Just Care and Social Security Works and Louise Norris of healthinsurance.org to answer some of your health insurance questions. Our first question is for Louise. Open enrollment for health insurance through the Affordable Care Act continues, although the first deadline may have passed. Tell us what people need to do to get signed up for health insurance. Louise?
Thanks, Laura. So the first deadline refers to when you need to sign up to have coverage that starts on January 1st. And that deadline has actually been extended in the majority of the country. Instead of December 15th, it's been pushed out to Wednesday, December 18th by the end of the day, by midnight on Wednesday, December 18th, in the 31 states that use healthcare.gov. And the other 19 states and DC run their own marketplace, so they have discretion on their own deadlines. But more than half of them also have either December 18th or a later deadline. Some of them will let you enroll all the way up till December 31st and get a January 1 effective date. We do have a list of all those state-by-state deadlines on healthinsurance.org. But there are about 8 or 9 of the state-run exchanges did switch over as of December 16th to enrolling people for February 1 coverage. So you can still sign up, but you're getting coverage effective February 1 instead of January 1. But if you want that January 1 coverage in most of the country, you can still get it. You just need to really hurry up on getting enrolled, because in most of the country, the deadline on that now is December 18th.
Thank you, Louise. And for Diane, the Medicare open enrollment period finished on December 7th, but Medicare Advantage open enrollment period runs from January 1st through March 31st. What does this mean, and what do people on Medicare Advantage need to do or should do?
Okay, so good questions. What everybody needs to keep in mind is with health insurance, especially Medicare Advantage, there are lots of baits and switches. And so you may have signed up for a Medicare Advantage plan recently, and you might find in January or February that the doctors you thought were in the network because their names were in the provider directory actually are not in the network, or you might find that other additional benefits you thought would deliver something that you needed are not really what you thought they were. And what the government does as a result is it gives you an opportunity to switch Medicare Advantage plans or to leave Medicare Advantage altogether and go to traditional Medicare. So what I would advise everyone to do if you're in Medicare Advantage is take a good hard look at what you have in January. Make sure that the doctors you want to see are in the network and that you'll be able to see them. Make sure that the costs are what you expect them to be. Sometimes they go up enormously. If you haven't switched plans, the same plan will charge a lot more the following year. And if the benefits are not what you believe them to be, you can switch to another Medicare Advantage plan. I would advise that you look really hard at the alternative, which is traditional Medicare. And that's because traditional Medicare actually doesn't change benefits from one year to the next. It has standard benefits that they actually cover from any doctor or hospital in the country willing to take Medicare. And that's about 95% of doctors. So if you're in traditional Medicare, the government administered program, then you can be sure that if you need to see a particular doctor or go to a particular hospital anywhere in the country, you'll be able to, and your care will be covered. And you won't have to go through hoops to get that care. There's no prior authorization in the regular Medicare program. If your doctor, your treating physician says you need something, as a general rule, you will get that care covered by Medicare. And if you're traveling and you need care anywhere, you can get that care covered. So the advantages of traditional Medicare from an access to care perspective are enormous over Medicare Advantage, where delays and denials are very, very common. and they're often inappropriate. So people who have cancer or some other costly condition have to wait often long periods of time before they get their care, or they can't see the specialist they need to see. The one unfortunate reality with traditional Medicare is that there is 20% cost sharing for your medical services. And so you need supplemental coverage to pick up that 20%. There's no maximum out-of-pocket cap. So without the supplemental coverage, you could end up spending a lot out of pocket. Now, having said that, in Medicare Advantage, you can have supplemental coverage, and your out-of-pocket costs can be many, many thousands of dollars a year as well. So look very carefully at your options in January. Make sure you have the healthcare coverage you think you have, and if possible, consider switching to traditional Medicare, which you are allowed to do, although you will need to buy supplemental coverage, and you have to make sure that you can do that. Some states allow it, other states make it hard, especially if you're sick. And that's basically the whole of it.
Thank you, Diane. Our next question is from Native NOLAgal from Twitter, who wanted to know, why did I get charged for my last colonoscopy? Is there any explanation you can think of? I assumed I had misunderstood the law. I have a marketplace policy. So she has a Affordable Care Act policy. Louise?
This is quite common. There's a few different explanations. And it's not just marketplace policies, it's all non-grandfathered commercial policies. So whether they're from an employer or from the marketplace, or a plan you purchase directly, a major medical plan you purchase directly from an insurance company that's compliant with the ACA, they all have to cover preventive care at no cost to you. This does include colonoscopies, but only if they're considered a preventive colonoscopy. And CMS has clarified that this includes the colonoscopy itself, and if a polyp is found, it includes the removal of the polyp and the biopsy of the polyp. They cannot change a preventive colonoscopy to a diagnostic colonoscopy because of the presence of a polyp. If you are trying to argue this with an insurance company or a medical provider, I have all the details about this written up on healthinsurance.org. If you go to our preventive care page, we have links to the CMS pages where they clarify that what is required to be covered. But there's two explanations for why you may have received a bill for a colonoscopy. One could be that it actually wasn't preventive. So a really common scenario there is colonoscopies to be preventive. You just have to be going in once every 10 years, starting no earlier than age 45, and then on an every 10-year schedule. If a polyp is found on your first preventive colonoscopy, they still have to cover the full cost of that. But almost all doctors are going to then tell you to come back in 3 years or 5 years for a recheck because the polyp was found. So that follow-up colonoscopy, because it's not happening on the regular 10-year schedule, is not going to be considered preventive. It is going to be considered diagnostic, and you are going to have to pay whatever your plan's cost sharing is. So that could be deductible, co-insurance, co-pays, depends on how your plan is structured. But if you're going back for a colonoscopy 5 years after your first one because they found a polyp on the first one, you are going to have to pay for the second one. The other scenario, and also a diagnostic colonoscopy, could be because you had symptoms. Maybe you had GI distress, maybe you had blood in your stool, anything like that. If they are going in to diagnose an issue, even if, say, you're 45 and you haven't had a colonoscopy before, if there's an issue that they are looking to diagnose, that colonoscopy is no longer considered preventive. It is considered diagnostic, which means you pay for it according to whatever your plan's cost sharing is. So the other issue that comes up far too often, more often than it should, is despite the fact that CMS has very clear rules on preventive care colonoscopies, it is not uncommon for either the GI office or the pathology center or the health plan to switch it over to a diagnostic colonoscopy because a polyp was found. if that's the scenario and it was a preventive colonoscopy and you went in because you were just on an every 10-year schedule, nothing to be diagnosed, no previous issues that you're following up, they are not allowed to switch it to diagnostic, but unfortunately, sometimes they do. So that's where you can argue the case with either the pathology center or the health plan or your GI doctor. And we do have links on healthinsurance.org where you can get the details of exactly where CMS has said you don't have to pay for this. So it is important to be educated and know what to expect when it comes to colonoscopies, because they are a procedure where it might be covered in full with no cost sharing, or you might have to pay for it. And it really depends on the circumstances. But if you get a bill, don't just assume, oh, I guess I have to pay for this. Make sure you know for sure that it's being correctly billed before you pay for it.
Thank you, Louise. Our next question came in via email. My health insurance company, GEHE, just tried to make it extremely difficult for my spouse and myself to stay with FEHB for federal retirees, which is what I am. They gave us the option of a new program called SilverScript for our pharmaceuticals, which basically would have put us into Medicare Part D, although we're signed up for FEHB and Medicare Part A. As a federal retiree, I choose to stay with FEHB as it means that my spouse and I remain covered under one policy instead of being in two separate policies with two separate premiums and two separate deductibles. I had to spend over 5.5 hours on hold on the phone to finally get a person who could record me and separately my spouse declining their offer. So Diane, can you tell us what's going on here?
I'm not sure what's going on there other than the usual insurance company bureaucracy and headache and the employer possibly saving money by trying to push this couple into the SilverScript program. I can't say more than that, but what I can say for sure is absolutely if you have FEHB, FEHB, and you want to stay in that program, you do not have to sign up for Medicare Part B. You can save that money and stick with your FEHB as your primary coverage, even if you are retired. That said, your FEHB plan can come in a lot of different forms. It can be an HMO, it could be a fee-for-service plan, it could be comprehensive or less so. If you're in traditional Medicare, as I have said over and over, you do have a great choice of doctors, basically any doctor in the country and hospital with few exceptions, and can get your care anywhere. With your FEHB plan, it will depend. And I don't know what your out-of-pocket costs are with your FEHB plan. With Medicare, if you had Part B, your FEHB plan would pick up all the costs that your Part B plan did not pay for. But you would be paying a lot for your Part B. So all I can say here is if you're happy with FEHB, great. Just make sure it's going to do everything you need. I believe you always have a right to switch to Part B and drop your FEHB. But once you do drop your FEHB plan, then you can't get it back. And so I'm very sorry you had to go through that. It seems like so many of us have to go through all kinds of hurdles to avoid getting put in a health insurance nightmare that we want to avoid. But it seems everyone's pushing us into these for-profit corporate plans.
Thank you, Diane. And speaking of corporate for-profit health insurance nightmares, welcome to our guest for this show, Wendell Potter, the founder of Center for Health and Democracy and a health insurance whistleblower. So thank you for joining us, Wendell. And let's talk about the recent killing of the UnitedHealthcare CEO and what it's revealed about what's going on with health insurance in America.
Well, thanks so much. And thanks for having me on. You and Diane and Louise are my heroes. Love the work you all do. What we have seen over the past several days is just this outpouring of rage on the part of so many Americans who reacted to this terrible murder in New York of an executive of United Health Group, Michael Thompson, who was president of the health plan division, which I think just kind of didn't shock me, because I have known, and many of us have known for a long time, that people are very unhappy with our healthcare system, have been denied needed care, have been stuck with bills that we thought would be covered. And sadly, it is not until we get sick or injured that we realize in many cases just how inadequate our health plan really is. But as these companies, these big corporations have gotten bigger, more and more of us are now enrolled in these big plans. When I first started working in the industry, I worked for Humana and then Cigna altogether for about 20 years. At the beginning of that time, most of us actually were enrolled in nonprofit Blue Cross plans or Kaiser plans. It was relatively rare for folks back then to be enrolled in a big for-profit plan, but that has changed. Most of us now are, and that makes a world of difference, because it's notable that Brian Thompson was in New York on United Health's Investor Day. I used to help plan Cigna's Investor Day. It is probably the most important day, at least from the perspective of the CEO and CFO and the investor relations people, because that's the day that you get to tell your big shareholders and Wall Street financial analysts how profitable you are and how profitable you think you will be in the next year, and how you'll be able to continue to reward them handsomely in ways that they expect to be rewarded. So what I do as much as I can is help people understand the consequences of us now being in health plans that are for-profit, traded on the New York Stock Exchange, what that means for all of us. Because I can assure you, after working for these companies, my name was on all of Cigna's earnings releases for 10 years. What is most important to those executives is meeting Wall Street's profit expectations. Because if you don't, you're going to see a sell-off of your stock. The value of your stock will go down. And if you're an executive, that means your net worth will go down as well, too. Sadly, to meet Wall Street's profit expectations, these companies have increased their use of prior authorization, or requiring your doctor or the hospital to seek approval in advance before getting assurance of being covered for that treatment or test or medication. And we have to pay, in many cases, thousands of dollars out of our own pockets before our coverage kicks in. These barriers, I call them, have been put in place. And also, as Diane and others have mentioned, in many cases, the networks of doctors and providers are inadequate. So you may not even be able to see the doctor or go to the hospital of your choice because of the way these health plans, provider networks are structured these days. And they change every single year. So you better keep an eye on if you're in a plan, if your doctor is going to be in the plan next year. You need to take time to check all that out. But it is because of the Wall Street takeover of our health insurance companies and the health insurance industry that we, in my view, are facing so many problems, and why we saw this rage that has been showing up in social media since that murder.
Mm-hmm. And I can speak to this personally, because when I was diagnosed with cancer 7 years ago, I went to the hospital. I had surgery, and I got a $100,000 bill. So for the next several months, as I was going through chemo, as I was advocating to save the Affordable Care Act, I also was going through the appeals process and getting nightmare stacks of mail and past due letters. And this is really frightening for somebody that's going through maybe the worst health moment in their life, that they're getting deluged with all these bills and bill collectors. So people are in no mental state to fight, and yet they have to fight. So I understand where this rage is coming from. Why do you think that there really hasn't been much of a response from Congress? Because this is a widespread issue. Everybody has a health insurance horror story.
Yeah. I think it's because these big companies have members of Congress by the short hairs in many cases. They spend so much money on campaign contributions. Almost every member of Congress has taken campaign contributions this election cycle from big insurance companies. It's why I wrote my second book, which is called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. That plus we're in this odd time of this lame duck session of Congress in which they need to pass some year-end legislation to keep the government from shutting down, and they're just trying to reorganize or plan for who's going to be in what leadership spots next year. So it's a chaotic, different time, but I think it's largely because the politicians don't know exactly how to respond. I think that's going to change, because I think that this anger can be channeled, and lawmakers will become more aware of this rage. A lot of these people certainly have reached out to their members of Congress as constituents, but they haven't acted all that much yet. But I am beginning to see some bipartisan interest, believe it or not, in some significant reforms. There's a lot of work to do, and it's going to be, I think, a special challenge next year with the new Congress and the new administration to figure out how advocates can push forward on helping to change this system.
And I want to speak to what a lot of people may be feeling right now is it was so hard to get the Affordable Care Act passed. And it was so hard to keep the Affordable Care Act, which was a partial solution. It made things better, but you can't say that healthcare is available to everyone who needs it in America, because that just isn't true. So when people feel helpless and hopeless, I think it's important to recognize that whether or not we get federal legislation next year or in the next few years, it is possible to make change on a state level. And in fact, Governor Pritzker in the Illinois state legislature passed a suite of bills called the Healthcare Protection Act that reins in health insurance companies in the state of Illinois. It bans junk insurance. It bans step therapy. It bans prior authorization for mental health crises. It puts a lot of restrictions on how health insurance companies operate in Illinois to protect patients. And so I think it's important to let people know that, yes, this is hard, but we can do hard things. And whether or not there is a path for big reforms anytime soon in Washington, D.C., you could start at your state level, because it can be done. We saw it get done, or some things get done in Illinois just this year. What do you think about that?
Oh, it's absolutely right. I think, in fact, the way forward often is through the states. Thanks for pointing out the wonderful package of legislation in Illinois. And that can be, and often is considered model legislation for other states. I spent a time as a consumer rep to the National Association of Insurance Commissioners. So elected officials and appointed officials have some role in lawmaking and regulating. So it's very important to keep an eye on what's happening at the states and to advocate for reform at the state level. And many states, as we know, it's often referred to as a patchwork of regulation, and it's true. But state lawmakers and regulators have a huge role to play, and do play in health benefits. It doesn't apply to everybody, because a lot of people who get their coverage through their employers, they're actually exempt from state regulations and laws. So there is that. But still, a lot of people are able to get protections from state laws and regulations that are on the books.
So if you were taking action right now, if you were writing legislation, or if you were advocating for legislation in Congress, what do you think Congress should be doing about this?
Well, a number of things. One certainly is addressing the use of prior authorization in the Medicare program and across the board in private plans. Curtail the use of that, because people are not getting medically necessary care. There's bipartisan support for that. There's bipartisan support for reining in the pharmacy benefit managers of these companies, or some of the biggest ones that are sucking so much money out of the pharmacy supply chain. I think there very well could be something that's enacted there. Medicare Advantage, as Diane in particular has talked about, needs to have plenty of reforms where the government is overpaying these these companies, these private companies that participate in that program. And keep in mind, these are private plans. They call it Medicare Advantage, but they're operated by big private insurance companies. United is the biggest, CVS and Humana, CVS, which owns Aetna, are right behind. So I think there's growing interest and support for looking at those overpayments and addressing the use of prior authorization of Medicare Advantage as well. So I'm hopeful.
Mm-hmm. And for somebody that's listening right now, if they are facing their insurance not covering something that needs to be covered or refusing to pay for medical services that were already provided, do you have any recommendations for how people can fight big insurance and win?
Generally, be a squeaky wheel. I've always advised people to do that. As you said, when you're sick, it's hard to do that. But try to find someone who can be your advocate. Look for nonprofit organizations that are working in this area, or find someone you might be able to hire to be your navigator, or your someone to help you fight back. Marshall Allen, who was a ProPublica reporter, who sadly died last year, wrote this wonderful book called Never Pay the First Bill. I recommend reading that, because so often we get these notices that our company we have to pay something, a bill from a hospital or whatever it might be. Become educated, but also try to find someone who can advocate for you. Go to the media, write letters to your members of Congress, your state legislator, your Department of Insurance. Just be as squeaky as you possibly can, and appeal. Most people don't know their appeal rights, or many people don't, or they think it's futile or just too complicated. Try, because it can save your life and certainly save you money if you go through that process.
And what do you think UnitedHealthcare and any other big insurers, do you think they'll change anything based on this public outcry? Or do you think we need to pass legislation or rules to get the insurance companies to change any of their business practices?
You will absolutely have to have changes in laws at the federal and state levels, because these companies have no incentive really to change things on their own. The status quo is extraordinarily profitable for them. I think if I was in the industry, I would be working to try to figure out, how do we weather this storm? How can we say things that will encourage lawmakers and employers to think that we can self-regulate, that we can change? Don't believe them. That's not going to happen. They might do some things that that are cosmetic, or that they promise to do, but there's very little accountability. I think you're going to have both employers, because they play such an important role in the private sector. So many of us get our coverage through our employers. They need to step up and be more visible and vocal, and trying to rein in the excesses and the problems that we have, the business practices with these big companies. But also politicians, obviously, at the federal and state level. We cannot expect that these companies will change on their own, because it's just too profitable for things to go on as they are.
And how can people stay in touch and follow your work holding health insurance companies accountable? How do people keep following?
Well, thanks very much. You can follow me on social media at Wendell Potter. I think that's on X as well as Instagram. Sign up for my newsletter, which is free. It's Healthcare Uncovered. It's healthcareuncovered.substack.com. We started that because the media wasn't doing a very good job of holding these companies accountable and investigating their practices and reporting on them. So that's what we do. And we also try to help people understand a bit how to navigate the system, and also what's happening in the private sector that's promising. So please look for us and sign up for our newsletter. No charge for it.
Thank you, Wendell. Thank you for joining us today. And I am an avid reader. And thank you, everybody, for joining us today. So please text or call in your health insurance questions at 202-838-6837, and we'll answer them in future episodes. And join us next week for more. And be sure to subscribe to my channel or podcast wherever you get your podcasts. This is Care Talk.